a very uncomfortable place to have a lump. So if you develop one in or around your vagina, you want to know why and how to get rid of it very quickly. Hi, I'm Dr. Sylvia, a general practitioner and health educator with AskAwayHealth. Welcome back to the channel. Here we give you health information to help you live better. And believe me, if this is the kind of information that you need, please go ahead, like this video, and do consider subscribing to the channel. And don't forget, you can follow us on social media. Our account is @AskAwayHealth on Facebook, Twitter, and Instagram. The vagina is a tube open at one end but closed off by the cervix at the opposite end. On the inside of the vagina are tissues that produce fluid that helps to clean and maintain the environment of the vagina. There are several possible causes of vaginal lumps or bumps. Here are 7 common ones. First, Bartholin's cyst. This is a fluid-filled sac that can form on one of the Bartholin's glands that are located near the opening of the vagina. And usually it's felt as a small, often it's painless lump unless it starts to get bigger. It can lead to pain when walking or sitting or during sex. Sometimes the cyst can get infected and then it would swell very quickly. And what you might feel is an excruciatingly painful swelling right at the opening of the vagina on either side. It might also feel hot and you may also develop a high temperature. This usually means it has grown into what we call a Bartholin's abscess. Small painful cysts that are not infected can be treated with painkillers, while an infected cyst will need antibiotics. Treatment can also include a surgical procedure where the sac or the cyst is burst and drained and antibiotics are given. Number 2, genital warts. These are commonly caused by low-risk strains of human papillomavirus, that is HPV, and they appear as small fleshy bumps on the genitals. So they can happen as single or multiple growths. They can happen separately or close together. They are usually painless, but they have the potential to grow in size and spread. It is essential to treat them and at the same time test for other types of sexual infections. Warts can be treated in different ways. So the treatment options include, first, no treatment at all, because 1/3 of visible warts disappear by themselves within 6 months. However, many do not, and they can be unpleasant and quite disfiguring, leading to anxiety and distress. Another option are self-applied creams or ablative methods like heat therapy, removing it, or electrocautery. These should be considered only if the practitioner, that is the person providing them, is appropriately trained. Now, while these treatments can be very effective, sometimes they can leave scars or changes in the pigmentation around the areas where the warts were located. So it looks different, and that contributes to distress about the change in the appearance of the vagina. The HPV strain that causes warts is not the same as that which causes cervical cancer. However, it is possible you could get infected with the high-risk strain at the same time. Therefore, please make sure you maintain regular cervical smears to identify any changes early that could suggest cervical cancer. The next causes of lumps or bumps in the vagina is herpes. Genital herpes can cause painful, fluid-filled blisters that appear in or around the vulva and the vagina. Genital herpes is transmitted by sexual contact and it's caused by a virus called herpes simplex. Once you have this virus, it stays in your body. The symptoms can start quite quickly, or they may delay several weeks after contact with an infected person. The person or your partner doesn't show signs of being contagious, which is why we recommend using condoms or dental dams, as well as avoid sharing sexual toys. If you develop these blisters, they will soon burst and leave red, open sores around your genital area. Apart from pain, they may be itchy, tingling or burning, and cause very severe pain when passing urine. Some women may also have an unusual vaginal discharge. There is no cure for genital herpes, and the symptoms will clear up by themselves. However, going to the sexual health clinic to look at options for treatment and more testing is very essential. For example, you can get painkillers, and if it is within 5 days of the symptoms developing, antiviral drugs which could stop the symptoms from getting worse or shorten the duration of the outbreak. I'd love you to remember these facts about how you can catch genital herpes. It is very easy to pass on from the time you feel the first tingling or itching of a new outbreak before blisters appear, right up to when the sores have fully healed. It's possible to pass from skin to skin contact with the infected area, including vaginal, anal, and oral sex. It is possible to catch genital herpes when there are no visible sores or blisters, if a cold sore touches your genitals, by transferring the infection on your fingers from someone else to your genitals, or by sharing sex toys with someone who has herpes. The next common cause is ingrown hair. Yes, this happens when a hair follicle becomes trapped under the skin around your vagina, and it can cause a small bump or pimple-like lesion or spot. And we have something called a Cystocele. Have you heard of that before? Now, this condition is one where the bladder bulges into the vagina, and it causes a lump or bulge when it does that. It develops as a result of the weakness of the pelvic floor. It's common in older women, women who've had multiple pregnancies, or if a woman is overweight. Please check out my video on how to strengthen your pelvic floor. I'll put the link for you in the description box as well. Another cause of a lump or bump in the vagina is cancer. Although it is rare, cancer can lead to lumps or growths in the vaginal area. Vulval cancer can lead to skin changes, including a wound that refuses to heal or irregular tissue in that area. And of course, I can't miss this out, pimples or acne. Because yes, like other body parts, pimples and acne can also occur in the skin around the vaginal area. They can even develop into boils which need antibiotics. Some women suffer repeat boils or skin infections in parts of the body, like under the armpit or the groin. This is a condition known as hidradenitis suppurativa. So, suppose you have concerns about a vaginal lump or a bump. You can see there are many causes. So consulting a healthcare professional for proper diagnosis and treatment is essential in that case. Remember, you can contact me for any further clarification. Please use the email Health Information Service or our digital concierge. As usual, the links will be for you in the description box below. And if you found this video answered a few questions and was helpful to you, please give it a like, consider sharing it with a friend, and subscribing to the channel. Go ahead and check out other helpful health information videos in our library, and I will see you again soon.